Hello, I'm Jeremy Fernandez. On this edition of The Virus, Victorians march towards an easing of restrictions set to be outlined by the Premier Daniel Andrews this weekend. Plus, after a spike in community transmissions in New South Wales and Victoria, case numbers appear to be trending down again. But the same can't be said for Europe, where infection rates are surging. But first, an agreement between the Commonwealth and the Northern Territory government to use a quarantine facility for returning Australians will run at least until March next year. The initial program will see 8 Qantas flights from London, New Delhi and Johannesburg arriving over the coming weeks. Each plane will carry 175 passengers. The first flight leaves London on Thursday. Officials from the Department of Foreign Affairs and Trade are trying to ensure that the most vulnerable people who are registered to come home are given priority access to those flights.
The seats on those flights are being sold by Qantas, but Qantas has the priority list of vulnerable passengers who are in the UK that get the first opportunity at those seats on those flights. And our High Commission there is contacting all of those individuals and giving them the opportunity through Qantas to be on those flights so they could return. But the good news is of the around about just over 4,000 Australians who are identified and DFAT identified as vulnerable on the 18th of September, just over a quarter of those have now been able to return to Australia.
There's good news too in Queensland, where coronavirus restrictions have been eased. The decision to move parts of the Stage 5 roadmap forward coincides with the state marking 36 days since its last case of community transmission.
People at formals will be able to dance again. Up to 40 people at a time will be able to dance at weddings. And residents of aged care facilities of nursing homes will again be able to go on excursions to the beach, to play bingo, that sort of thing. So this is a great outcome. It allows us to further ease restrictions.
On the other side of the country, the Finance Minister Matthias Cormann is accusing the McGowan government of keeping the border closed without justification. The WA government's latest health advice is that the border should remain closed to all states and territories for at least 2 more weeks. That advice came after the state's chief health officer and health minister talked up the prospect of WA's border reopening to some parts of the country. The WA senator has repeatedly called for his home state to be opened to other jurisdictions with no cases of community transmission.
I've called on the Premier for some time to explain to the West Australian people that if 0 active cases and 0 locally acquired transmission for months on end is not good enough, what is good enough? What are the objective, predictable criteria that will enable businesses to have confidence that there is a pathway out of this severe set of restrictions?
14 visitors from New Zealand have been detained in Melbourne after arriving in Australia as part of the Trans-Tasman bubble. The ABC understands the passengers first flew to Sydney, then got a connecting flight to Melbourne. Victoria isn't currently accepting overseas arrivals. The ABC has contacted Border Force for comment about the detentions. Victorians, meanwhile, have been praised for driving down case numbers there. The state has recorded its lowest daily increase since early June. There have been just 2 new infections recorded in the past 24 hours. There's also been positive news in New South Wales, where just 1 case of community transmission was confirmed during the reporting period. However, late today, news broke that a staff member and an infant at a childcare centre in southwestern Sydney have tested positive. The infectious diseases specialist at ANU, Sanjaya Senanayake, joined me earlier with some analysis on the latest developments here and overseas. Associate Professor Sanjaya Senanayake, welcome to The Virus.
Hi Jeremy, how are you?
Now, this was going to be a momentous weekend, particularly for Victorians, because they were looking at the lifting of restrictions on the 19th of October if that rolling 14-day average could be brought below 5. It's sitting somewhere between 8 and 9 right now. Why is this tail of the virus so stubborn?
Look, Jeremy, unfortunately, this is the nature of the virus, and it's no one's fault. We think that a small percentage of patients or people with the virus are responsible for the majority of cases. So a lot of people who have the virus won't necessarily infect anyone, but then you might have 1 or 2 people who cause big clusters. And that's the problem when we're watching these daily averages. You'll have very low numbers, and then suddenly a super spreading event occurs and throws everything askew. In many ways, while at the same time we need to reassess all these targets, I think it's really important to do so. If Victoria hadn't done it, given that they've only had, I think, 2 cases today, it's quite possible that when they get to the 26th of October, which was the original date they were going to review the next stage, they might be fine. But unfortunately, they fast-forwarded it, and these cases occurred, and it's thrown the plan somewhat askew.
How long before we know how bad these clusters are, in Shepparton, Kilmore, Sydney, Melbourne?
Look, I would have thought, now we talk about the incubation period being up to 14 days, but usually the median incubation period's about 5 or 6 days. So I would have thought within the next week we should get a good idea of what is going on. I think I understand with Shepparton, I don't know too much about the local geography, but I understand there is a fairly sizable Indigenous community who we obviously want to protect because they are vulnerable from this to this virus. So hopefully it won't get into that Indigenous community there.
Is there a difference in your mind between how Victoria and New South Wales are treating restrictions? Because at the same time as Victorians are being told they'll need to be under these stay-at-home orders potentially for a bit longer, New South Wales is looking at lifting its restrictions again. They're loosening them up a little bit more. Is there a difference, do you think, in the way the virus is being treated in each of those states?
Oh, look, definitely. It's a tale of two outbreaks and 2 strategies. So New South Wales is treating it more as a control strategy where they're accepting a certain number of cases and learning to live with the virus, but then responding if we get a higher number than that acceptable level of cases. Victoria, of course, is coming off an extremely nasty outbreak, peaking at 700 odd cases a day, which for Australia is very bad. And there were issues talked about, such as if their contact tracing capability was quite as good as or quite as resourceful as other parts of the country. The Chief Health Officer talked about the outbreak being different in Victoria than compared to New South Wales because larger households were involved, which meant potentially more cases, more contacts, etc. So it has been 2 different outbreaks, and I think in a year or 2 we'll look back and valuable lessons will be learned, and we'll decide what the optimal way to have addressed the outbreak in each state would have been. But right now, it's quite different.
A year or 2, that sounds like an awfully long time away.
Absolutely, and I guess I'm just thinking in terms of what we've got to look forward to with COVID, and really a vaccine in terms of being deployed into the general population here in Australia. I mean, it's been speculated when that might occur. I'm someone who feels it's probably going to be closer to the middle of next year if some of these vaccines in their phase 3 trials actually work. So we've got probably more of the same for at least a good few months next year.
The Prime Minister's confirmed that tens of thousands of Australians who've been stranded overseas are going to start being brought back at a rate of about 500 every 2 weeks, 1,000 a month, and they're going to be housed at a quarantine facility, Howard Springs in the Northern Territory. The Northern Territory Australian Medical Association has expressed some concerns about infection controls at that facility and the potential for it to explode into, among the local population there. Do you share those concerns, knowing what we do now about the way the hotel quarantine was handled in Melbourne?
Look, absolutely. In terms of Australia, the biggest risk of reintroduction of COVID into the community is still going to be hotel quarantine in terms of the highest rates of COVID that we're seeing. And as you correctly mentioned, we saw what happened in Melbourne when things don't work according to plan. However, in a number of other states and territories that have been receiving people from overseas, that hasn't been the case. So that means that it can be successfully implemented. However, whatever it takes, we have to make sure that it is done properly. because the Northern Territory, as we were talking about with potentially Shepparton, there's a large Indigenous community, and we don't want the virus spreading into Indigenous communities.
It does seem like we've learned a lot of lessons collectively since the Ruby Princess outbreak, the hotel quarantine issue in Victoria. So hopefully things in the Northern Territory go a bit better. I want to turn to Europe, where they've had major spreads over the summer. You know, people heading outdoors, it's been warmer weather, more daylight. How much do we take that as a predictor of how our summer is going to play out in Australia?
Oh, look, yeah, Europe is a train wreck when it comes to COVID. It's really, really bad at the moment, and we can see that in the response of leaders such as Emmanuel Macron, who's asked for or ordered curfew in a number of French cities, including Paris. So it's pretty bad at the moment. Now, in terms of what will happen in Australia, I would hope that it won't be as bad in Australia compared to Europe, because we have accepted much higher levels of restriction. We've got a lower tolerance for cases, I think not just as governments and health authorities, but as a nation of citizens. We're completely different to Europe, who opened their borders to so many other countries, tried to relax their restrictions in such a way that they were leading close to a normal life, and before things went out of control. So I think in Australia it won't be that bad, added to the fact that despite our large landmass, we've got a much smaller population, so population density overall isn't such an issue. So I think it will be a much better summer here than there. But of course, there is the opportunity for outbreaks because people will be moving closer together.
In the meantime, the studies about coronavirus are continuing to roll out across the world. I know you've been looking at one in particular about the persistence of immunity after infection. What does that study tell us?
So a couple of studies have just come out, and one in particular from the US examined people who were infected earlier in the year, and they were able to conclude, looking at the levels of neutralizing antibodies, so those antibody proteins that stop the virus from entering the cells, they were able to estimate or predict that immunity lasts at least for 5 to 7 months. Now, that doesn't sound like a very long time, but there'd been a study from King's College in London earlier this year which found that even after 3 months, immunity in terms of antibody levels seemed to drop off quite significantly. So if we've got immunity that lasts for at least 5 to 7 months, and we know with other coronaviruses we probably get 1 or 2 years immunity out of it, that is much better news than thinking it only lasted about 3 months. And also in terms of vaccination development, that is, or vaccine development, that is very useful and would help us hope that the vaccine lasts for much longer. And of course, having said all that, the best test to know about how long immunity lasts is to see if someone gets reinfected. And that's happened about 5 times now, with the latest case coming from the US.
Dr. Sanjaya Senanayake, good to have you on the program again. Thanks for joining us.
Thank you so much, Jeremy.
The World Health Organization is forecasting that hundreds of thousands of people in Europe could die from coronavirus by February if restrictions aren't enforced. Nearly 700,000 cases were reported on the continent this week. London is the latest city to be imposing new measures to combat the exponential rise in infections.
For the first time in 7 months, the Queen was out from behind the palace walls, mask-free, but with plenty of precautions and social distancing. But while Her Majesty stepped out, London was locking down.
More patients are going to intensive care units, and sadly, the number of Londoners dying every day is increasing again.
The British capital and its 9 million residents are now on high alert, the second on the 3-tier system, meaning from the weekend households will be banned from mixing indoors.
Things will get worse before they get better.
The messaging we're getting from the government is so confusing. Don't think it will work, think it's a waste of time, it's affecting businesses.
While workplaces and schools remain open, a complicating factor is Londoners are also being told to avoid public transport. London's mayor has warned the virus is spreading in every corner of this vast city, and soon there'll be an average 100 cases per 100,000 people. He says there'll be a difficult winter ahead and is demanding the government introduce a 2-week national lockdown. Across the Channel, there's no better news. Case numbers across Europe have increased by 40% in a week. The WHO warns daily death rates could reach 5 times their April peak without effective action. Samantha Hawley, ABC News, London.
In India, case numbers have now passed 7 million. The country recorded more than 74,000 infections on Sunday alone. Despite that, the government's pushing ahead with plans to reopen ahead of the festival season. India's economy shrank by almost a quarter in the 3 months to June. The pandemic has also had a significant impact on South Africa's economy, where relief grants for 6 million of the country's unemployed are being extended. President Cyril Ramaphosa also announced a series of infrastructure projects to stimulate the economy and to create jobs which were lost during the country's strict lockdown. Around 2.2 million jobs were lost in the second quarter of this year, taking South Africa's unemployment rate to a record high of 42%.
Even if you can see outside, everywhere is empty because of the corona issues. No business, nothing is going. We come out Sundays, we can't even meet our daily meet. But we keep pushing. But we believe that everything will be fine soon because Ramaphosa is a good leader and is focusing to improve the economic of this country. And we believe in the short times, things will become better.
Russian authorities have given regulatory approval for a second coronavirus vaccine that's only reached early stage trials. The 2-shot treatment has been tested among 100 volunteers in early stage human trials, which wrapped up 2 weeks ago. Scientists are yet to publish the results of their study, but claim the vaccine produces enough antibodies to immunise someone for up to 6 months. Australian researchers, meanwhile, have discovered the virus can survive on some surfaces for much longer than previously thought. They've found that while it can stay alive on most surfaces for up to 7 days, on other materials it could remain active for a month.
The dreaded cough. It's well understood how it can expel droplets containing coronavirus. If it lands on a surface and is picked up by someone who then touches their face, that person can contract COVID-19. Now scientists from the CSIRO have found the risk of picking up the virus in the environment is higher than previously thought.
We took a sort of an artificial mucus and we suspended a set amount of virus in this solution and then dried it onto different materials.
Their research shows at a temperature of 20 degrees, the virus remains potent for up to a month on glass surfaces such as touchscreens, stainless steel objects such as cutleries and handrails, and polymer banknotes.
It's really important that, as we know right from the start, the importance of hand washing, the importance of cleaning and sanitising, both for ourselves as individuals, but also for those high-touch surfaces.
On substances like cotton, the virus didn't survive longer than 14 days. And when the temperature rose to 30 degrees, the virus didn't survive past 7 days.
During the pandemic, we've been urged not to use cash, and that would seem to be good advice, with this research suggesting the virus can live for up to 28 days on plastic notes.
But experts caution the research may not reflect what happens in the real world.
This is certainly not going to be the primary mode of viral transmission in the community, and we see that. It's a mode of transmission, but it's not the primary viral mode.
And that means while hand washing remains an important part of infection control, so does keeping your distance and mask wearing. Sophie Scott, ABC News.
A new advertising campaign is underway to encourage us all to explore what's right on our doorsteps. And to do so, Tourism Australia has recruited some high-profile names to pitch the message and help revive the ailing tourism sector.
I need a holiday.
Do you?
Yeah, for Australia.
What about the outback?
Yes, yes.
We could catch our own lunch.
I know exactly what you mean. Oh, honey, I could teach the kids to surf.
You don't know how to surf.
Yeah, I mean, obviously someone would teach me and then I would pass on the wisdom to them. You know what? Maybe, we have a fancy night in, for Australia.
I think I'm ready for a night out.
Yeah, we're going out.
And that is the very latest on this edition of The Virus. Don't forget you can keep up to date around the clock with the ABC News channel, ABC News Online, and of course ABC iView and the ABC Listener. I'm Jeremy Fernandez. Thanks for your company from all of us. Bye for now.